And I'd now like to welcome to the studio Dr. David Kwak, clinical instructor from the International Healthcare Center at Soonchunhyang University Hospital here in Seoul. Good morning, Dr. Kwak.
Good morning. Thanks for having me back here.
Thank you for joining us, especially in the midst of the so-called Golden Weekend. How was your weekend, by the way?
I finally got to bring my kids out to a playground right in front of my apartment.
Very good.
It was the fourth week that we finally got to go out with the children.
How did they react? How was it?
Oh, they were super excited about it. We spent hours just outside.
Very good. Yeah. So I want to actually start off by asking about your reaction. I mean, obviously kids are thrilled to be able to go out and these loosened sort of social distancing measures. But as a professional, do you think that the country is ready for the so-called everyday life quarantine? What was your sort of reaction? I'm sure your kids weren't the only kids outside, right? We saw a lot of people outside enjoying the weather and the long holiday.
Right. I would like to emphasize that I'm more of a conservative person,
obviously,
type of a person.
Because of your profession too, right?
Yeah. So I made sure that nobody was actually out when we were going out. So we made sure to leave home a little early, and it was just right in front of my house. So and we were able to see if other people were coming, and we made sure that we were wearing masks and everything.
You maintained that strict social, that physical distancing
yes,
too.
Yes, at least for the time being, we should. But with this, in regards to the lifting of the measures, I'm ambivalent, let me put it that way. So I'm very happy that we're seeing very low numbers and keep continuing to do so. But also at the same time, as a medical doctor, I have this little worry in my head that we should still be keeping very close eyes on the numbers and the measures that people are taking. So we should definitely keep personal sanitizing measures and social distancing measures, even when the restrictions are lifted. That is what I'm thinking currently.
Looking around me, though, I've already seen people a little bit more relaxed again because of the hotter weather. You know, it's difficult to keep the masks on, so they kind of bring it down to just cover maybe their mouths or maybe just their chins, which I don't think actually does any good whatsoever.
It doesn't do any good at all.
Yeah, but they're spending more time outside and they're socializing more. So we're definitely seeing that loosening of just, I think, people's mentalities as well. So are you worried about 2 weeks on from now that the numbers could spike?
Yes, I was actually going to mention that exact terms. We still have to look out 2 weeks ahead. Yeah. So after all these gatherings and whatnot, people vacationing, 2 weeks later, we need to get back to the numbers to see if they're actually decreasing still, or if there is any chances of it spiking up again, in which case we have to be more careful.
Because we did well with the elections.
Yes.
No cases from the election, but it was very sort of, in a way, controlled environment. There were very strict rules that everyone had to abide by to actually get in their vote.
Right.
But this is definitely a much more uncontrollable situation in a way.
Yes.
Yeah.
Yes.
All right. Over the past week that we talked to you last, we have seen a lot of news regarding COVID-19. As always, we're learning more and more new things about it, the various symptoms, maybe the similarities with other diseases as well. So I don't want to go through all of them because I think it's a little bit too much maybe for the general public to get their sort of wrap their minds around. And also maybe it may be too much information for us. So if I could ask you, with your expertise, to maybe single out a couple of items that came out in the news and maybe some things that we should be looking out for?
Will do. So there had been a news from the England that they found a number of children to be having a syndrome called Kawasaki disease.
Kawasaki sounds Japanese, but it's from
yes, it is named after a doctor in Japan. But so what that is basically is it's a secondary syndrome of symptoms that comes after more likely a certain viral infection. But we in the medical field, we haven't really been able to pick out one single source of viral infection that actually causes the syndrome. We believe it to be from many different possible sources. And the thing with it is that it has very severe flu-like symptom.
That's a Kawasaki syndrome.
That's Kawasaki disease. That includes a high fever, constant high fever, swellings in the feet and hands and the joints and inflammation in their lips and eyes and whatnot. But the thing with it is that it can cause very problematic consequences in children especially. But being able, currently seeing that there's a possibility that COVID-19 can also cause Kawasaki disease is something that doctors are currently being scared of.
Right.
Yeah. But also there have been reports of other very similar diseases that are very similar in their symptomatic aspects to COVID-19, such as SFTS. It's what we've had for a very long time in Korea, especially among people in the military that has to do a lot of works outside in the grass. They also
SFTS?
yes, it stands
Sounds
for
new to me.
Right, severe fever. I can't really remember the exact terminology. Fever and thrombocytopenia syndrome. It's where people start showing fever, diarrhea, nausea, and very unspecific symptoms, just like COVID-19 does.
Okay.
So it's quite indistinguishable when a person is just showing symptoms for anybody around them to discern. But it's also one of those disease that is diagnosed with a simple blood test. So once a person is able to go to a hospital due to their symptoms, doctors will be able to know what exactly it is and start the treatment.
Okay, so I see that there were some, we saw one reported case. The first reported case was from the Gangwon area, but as you're saying, it's easily distinguishable whether it's the SFTS or COVID-19 with
Once
a simple
they're in
blood test.
hospital, yes.
Okay, very good. I also saw some news regarding obesity. I mean, we had mentioned it before as a factor that could lead to more severe symptoms. And then in the past week, there were also news regarding, I think it was heart disease that it could cause. Is that related to or linked to obesity? I mean, obviously, we are the same human, but we have genetic differences, we have cultural differences, and it seems to be coming out a lot from the U.S., not so much Korea. Can you tell us about that?
Right. There was a study, I think, printed out just last week or so, that compared patients in the U.S. and in China, how they differed in their mortality rate and then the severity. And they've figured out that the biggest difference that they had among their populations was their BMI index, body mass index.
Right.
Meaning how obese you are. The people in the U.S. tended to be more obese, and they tended also to be more severe in their illness, and also they showed more mortality in the results. But different factors also count into this, both in regards to obesity and the heart disease. So let me start out by explaining a little bit of obesity. So for obese people, they have these what's called fatty tissue underneath their skin layers and also in between areas of their intestines. And that's where the exact terminology for that would be adipose tissue. And these are the cells that has so much of a fat inside, such as vacuoles and oils. But also they tend to have a lot of immune-related cells inside of them. And they excrete out what's called a cytokine. So a study recently that was printed out was stating that because of the immune cells that are able to excrete out cytokines, they're more prone to having what's called the cytokine storm.
Yes.
Yeah, so that's what's happening with the obese population here. But in regards to the heart problem, people who is having an enlarged heart due to many different underlying diseases also showed more severity and more mortality in the result. But that's believed currently to be due to the thing that I mentioned before, an enzyme called ACE2. The exact terminology would be angiotensin converting enzyme number 2. And it's an enzyme that basically converts an inflammatory molecule into what's more of a protective molecule. So it's a good thing that they have it, except people in dire distress, they tend to express much more of these enzymes out into the cells and in the blood. But these work and act as a binding site for COVID-19 to attach to.
So it's almost like an entry point for the COVID-19 virus to enter the body and then just stay there, right?
Exactly. So obviously, with the people and in the study, people with enlarged hearts tended to show much more ACE2 level on their blood, and which means that they are more prone to possible COVID-19 infections.
So I guess that's another reason why some of the reports regarding COVID-19 tend to differ from Korea and the U.S. I mean, the U.S. right now is the number one country most affected with a number of patients and deaths. So we see those different reports, and sometimes when I read those two reports and then we don't see something here in Korea relating to that, I'm thinking, does it not relate to us? Or what's causing these differences? As we mentioned, the BMI index, is that also the main factor then?
Yes, it would be a very big factor. There are also cultural differences as to where what percentage of the population would be smokers, what population of the percentage of the population would be prone to more chronic illnesses like diabetes and hypertension, which tends to all affect the results.
And also which point they enter the hospital, because as we were talking about before the show, in Korea, if you test positive, then basically you will be isolated. You may be entering a hospital. But in the US, oftentimes you'll be told to just rest it out. You'll stay at home unless you develop very serious symptoms.
Right.
And then you're admitted to the hospital.
Right. You're exactly right in saying that. So different countries were hit differently with the attack of the COVID-19 in the beginning stages. Korea was very lucky that we were sort of prepared with all these methodologies and being scared from prior experience with MERS. So we started isolating everyone who was confirmed, and that I personally think it made the biggest difference compared to other countries, because in the U.S. or even in China, when they were hit very big with the attack of COVID-19, they could not possibly
isolate everyone.
Right, they didn't have enough rooms to care for them all, so they pretty much had people with more severe symptoms only come into hospitals, but with milder symptoms to have them stay home and self-quarantine for at least 2 weeks and so on. And in Korea, once you are confirmed and are put into a facility, the only way you can get out of the facility is by testing negative twice consecutively. So we were, I guess, I could say, more strict in the management of people with confirmed diagnosis.
This week does mark a significant turning point, though, in our management of COVID-19. We are going to be entering that everyday life quarantine phase. And yet, all these authorities, both here and overseas, are warning us that there will be definitely a second wave of infections, and that we are far from, seeing the end of this, that it'll probably be with us for at least 2 years. What is your opinion on this? Do you also second that?
I would have to side with the KCDC stating such a statement.
Are we prepared for that second wave then? We've been doing so well so far.
Right. We have been doing well, but we would never be prepared for a second wave because not much has been done in regards to treatments and prevention of the COVID-19 virus specifically. We still don't have any specific antiviral agent. We still don't have any specific vaccinations against COVID-19. So I could positively say that we are not prepared at all for the second wave possible.
Okay, that's a pretty grim outlook, Dr. Kwak.
You are, and I'm sorry that I just stated it very bluntly.
Thank you for your professional and also honest opinion. One last question. We're running out of time now. A lot of guidelines have been mentioned by the government. Of them, or maybe there's another one that maybe you would like to leave for our listeners, since this is our last sort of COVID Live 19 update with you.
I would like to re-emphasize that keeping the basics, personal sanitary measures, keeping social distances, even when the restrictions are lifted, is the core thing that we have to remember and keep to ourselves.
Right. So maintain those social and physical distance and good personal hygiene.
Yes.
Thank you so much, Dr. Kwak.
Thank you.
I'm sure this won't be the last time that we see of you, but I want to thank you for all your expertise over the past weeks. That was Dr. David Kwak from the International Healthcare Center at Soonchunhyang University Hospital.